Thank you, Mr. Chairman. It is my honor today to introduce Dr. Roubideaux as the Indian Affairs Committee considers her nomination to be Director of the Indian Health Service. Dr. Roubideaux was born in Pierre and graduated high school in Brevet City in my home state of South Dakota. She is a member of the Rosebud Sioux tribe, where I'm fortunate to have many friends. The chairman might be interested to know her mother was from Standing Rock Reservation, which is straddling both South and North Dakota. We are very proud to have one of our own be nominated to this position. She has a bachelor's degree and a medical degree from Harvard. As you know, we have many unique challenges that face us in Indian country, and especially in the Aberdeen area. We would be well served to have Dr. Roubideaux as the IHS director. Her experiences as a patient, a doctor, and an administrator within the IHS system provides her with first-hand knowledge that she needs to be an effective director of the IHS. I look forward to welcoming Dr. Roubideaux back to South Dakota soon. I also look forward to working with her as IHS director to ensure the federal government does all that it can to fulfill its treaty and trust responsibilities to American Indians. Thank you.
Thank you, Chairman Dorgan, Vice Chairman Barrasso, and members of the Senate Committee on Indian Affairs. My name is Dr. Yvette Roubideaux, and it is an honor to appear before you today as President Obama's nominee to be the next director of the Indian Health Service. I'm a member of the Rosebud Sioux tribe, which is my father's tribe, and I'm also a part Standing Rock Sioux tribe, which is my mother's tribe. I have a long history with the Indian Health Service, first as a patient, then as a physician and a medical administrator. If confirmed, I look forward to working with your committee to do whatever we can to improve health care for American Indians and Alaska Natives. Even though we face enormous challenges in this time of hope and change, I believe we have a unique opportunity to begin the difficult work of restoring health and wellness to American Indian and Alaska Native communities. I am grateful for all that your committee has done to improve the health of American Indians and Alaska Natives. I know you understand the significant challenges facing the Indian Health Service. It is a healthcare system that is confronted with all of the same challenges facing the U.S. healthcare system today. But the Indian Health Service, which is different from all other agencies in the Department of Health and Human Services, also faces unique challenges. The Indian Health Service was established to meet the federal trust responsibility to provide health care to members of federally recognized tribes. The mission of the Indian Health Service is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. However, this task has become increasingly difficult over time. Rapid population growth, increased demand for services, skyrocketing medical costs, difficulty in recruiting and retaining healthcare professionals, long waits for referral services, and the growing burden of chronic diseases such as diabetes, obesity, and cardiovascular disease have created a significant strain on a system that is struggling to maintain current levels of services and in some areas faces reductions in services and potential closures. Despite these challenges, I see evidence of hope and change. As I mentioned, I have a long history with the Indian Health Service. I have seen up close the challenges of providing health care to this population with limited resources. However, I have also worked on a variety of projects and national initiatives over the past 16 years that have shown me the great potential that exists in the system to improve access to and the quality of health care. I know that thousands of committed and dedicated career staff in the Indian healthcare system work hard every day to provide healthcare to their patients under difficult circumstances. And I know that many facilities and programs in the Indian Health Service have implemented innovative programs and have helped solve some of our greatest administrative challenges at the local level. We need to do more to learn from those successes and apply those lessons to other programs in the system. In addition, with the new administration, strong allies in Congress, and renewed focus and energy on health reform from members of both parties, we have an opportunity to bring change to the Indian Health Service. President Obama is committed to ensuring that our first Americans have access to high-quality health care. Even as a senator, he supported increased Indian Health Service funding and passage of the Indian Health Care Improvement Act. New leadership in the Department of Health and Human Services will provide desperately needed support and direction. Congress has already passed legislation, the American Recovery and Reinvestment Act, that included critical resources for Indian country. And many members have demonstrated a commitment to doing even more. And in listening sessions held with tribes during the presidential transition, I heard a great call for change and for a renewed effort to improve health care for our people. With this outpouring of support, I cannot help but feel we are at a unique moment in time where we have the potential to make great strides towards fulfilling the mission of the Indian Health Service and towards improving the health of American Indians and Alaska Natives. I am ready to serve and work with you to improve health care for American Indians and Alaska Natives. If confirmed, I plan to focus on 4 priority areas. First, I plan to renew and strengthen the Indian Health Service's partnership with tribes. I believe the only way we can restore our communities to health is to work in partnership with them. Toward that end, I intend to work with tribes to review the existing tribal consultation process and to find ways to make that process more meaningful so that we can work more closely together on the difficult challenges and decisions that face us in the coming years. Second, as a part of the effort to reform our national health system, I plan to begin discussions with tribes, our healthcare providers, and our patients on how we can bring reform to the Indian Health Service. We need to undertake a comprehensive review of our system to determine how to better meet the needs of our patients within the parameters of both broader reform effort and the available resources in our system. With respect to both quality and delivery of care, I hope we can look at what we are doing well and do more of it, as well as understand what we are not doing well and come up with specific solutions. There may be difficult decisions ahead, but I am confident that in partnership with our tribes and with Congress, this administration can and will make the right decisions. Third, if I am confirmed, I plan to make improving the quality and access to care a primary goal of all of our work in the Indian Health Service. This has been a central goal of my work ever since I decided to become a physician, and I believe it is a primary wish of our patients. In order to restore their confidence in our system, we have to demonstrate that we provide high-quality care they know they deserve. We need to implement more strategies to increase access to care in our system, to improve the quality of clinical services that we provide, and just as important, to provide better customer service. Finally, we need to ensure that what we do to improve the Indian Health Service is transparent and accountable, and that we are as fair and inclusive as possible in considering the needs of all of our patients, whether they are seen in IHS direct facilities, tribally managed programs, or urban Indian health programs. I know we can make strides to improve care in the Indian Health Service. I have seen the best of what we can do in my work as co-director of the Coordinating Center of the Special Diabetes Program for Indians demonstration projects. This $27.4 million annual congressional appropriation created a grant program to translate scientific evidence into real-world diabetes and cardiovascular disease prevention programs. This successful initiative has proven that when the Indian Health Service and tribal and urban Indian programs are given needed resources and adequate technical assistance and support, they can step up to the plate implement a complex set of evidence-based services, evaluate their activities, and deliver positive outcomes that exceed everyone's expectations. These programs demonstrated that the Indian health system has the potential to markedly improve the quality of health care it provides if given the support it needs to be successful. I realize that we face enormous challenges and that this work will not be completed in days, weeks, months, or even years. But if confirmed, I am ready to begin the important work of bringing change to the Indian Health Service. I know our patients are ready for it, and I know there are many tribal leaders, Indian healthcare staff, and providers who have ideas for how we can achieve that goal. I am confident that we can all work together in this effort, and I will rely on the guidance and support of this committee as we move forward. Again, thank you for the opportunity to have a conversation about American Indian and Alaska Native healthcare today. I'm happy to answer any questions.